Literature has it that because gender is a social construct, because an individual in the long run performs more feminine roles, they may perceive or have feelings and identify with the female gender. That's why it's just showing it as a gender identity. If you go to sexuality, sexuality is a broad term encompassing an individual's sexual interests and behaviors involving biological, psychological, cultural, social, and spiritual aspects. It involves the body, mind, and spirit. So, in simple terms, when you're discussing sexuality, this is an individual's thoughts, what someone would like in sexual, what I've called here sexual interest, and someone's sexual behavior. So it involves biological. In biological would mean attraction to a particular gender. Psychological would mean someone's mental state of identifying with sexuality. And culturally, it is talking about cultural norms regarding sexuality. So all these aspects, whether psychological, cultural, spiritual, they make up an individual's. They are the ones that influence an individual's sexual interest and behavior, and thus they determine an individual's sexuality. Further, it is telling us that psychologically, sexuality is the means to express the fullness of love between a man and a woman. And there are different psychological ways of expression of sexuality. There are also biological ways. For example, intimacy is a way of expressing sexuality. Psychologically, gifts and hugging, these are all ways of an individual expressing sexuality. And there are several other ways an individual expresses as a sexual being. Sexual health. So then that now takes us into our main definition. But before we go into sexual health, I would want sexual health to come as the last bit. Before we go into that, let us just define these few two remaining key definitions. One being sexually transmitted infections, which is also another critical definition that we shall use in the course of this model. STIs, which are broadly known as sexually transmitted infections, are infections that usually passed from persons by sexual contact. Although some can be passed by other means, but the chances of passing through these other means, like needles, injuries, is minimal. They are also called sexually transmitted diseases, sometimes by different people. Sexual orientation is another definition that is common in the sphere today, because probably there is quite a lot of debate across the world on issues of accepting, especially in Africa, on issues of accepting LGBTQ individuals among our society. So sexual orientation is the romantic attraction or preference for sharing sexual expression with members of the opposite sex, one's own sex, which we commonly know as homosexuality, or both sexes, which we know as bisexuality. But we have also realized that there are other preferences of how individuals want to express their sexual self. We have realized of bestiality. These are all events that are generating as a result of the varying sexual orientation. So orientation is virtually a preference that someone prefers that they are romantically attracted or they share sexual expression with either a person of their own sex or another person of another sex or with both sexes, as that definition has. So let us just kindly go back to our last definition or concept, which will then take us into. There's one more. There's one other definition before we go into what sexual health is. After sexual orientation, just from here, they are saying that most people get a sense of their own sexual orientation in childhood or early teenage years when they have feelings or romantic or sexual attractions towards other people. Now, this is called socialization. When an individual is growing up at a tender age or at a young age, how they associate or how they socialize in their community, it is the habits that most times teach to them their sexual orientation. For example, it is evident that individuals who grow in a heterosexual society will grow up most probably being heterosexual. However, individuals who also would grow in a homosexual society would definitely have homosexual tendencies and therefore develop an orientation of homosexuality. Another definition here is sexual behaviors. Sexual behaviors are actions related to expression of one's sexuality. And we had earlier discussed what sexuality is. And I also stated that there are other different ways of how people express their sexuality. So that is what virtually sexual behavior is. Sexual behaviors and practices are what people do sexually with others and with themselves. And with themselves includes sometimes how people react. That is why we have different behaviors originating out of people's expression of sexual behaviors. We have people who are watching pornographic videos. We have people who do self excitement. These are all deviant behaviors, but they are all deviant in the sense that your social constraint does not allow such behaviors. Your social gatherings or cultures do not actually allow an individual to watch a pornographic movie or video. But because someone is expressing their sexuality, it becomes a deviant away from that society. However, in this world, there are other societies that would allow what we call deviance in our society. So then that takes us to the core of the matter, and that is sexual health in that regard. And what is the definition of sexual health? Sexual health encompasses physical, emotional, mental, and social well-being about sexuality. In simple terms, I just made a simple definition here. In simple terms, sexual health is the ability to express and enjoy one's sexuality free from risks of sexual transmitted infections, unwanted pregnancies, coercion, violence, and discrimination. This is this is a simpler definition that virtually is describing what the World Health Organization explains herein in this definition. According to the World Health Organization, sexual health encompasses physical, emotional, mental, and social well-being about sexuality. So it is more than just the absence of disease or dysfunction. Not having a disease or not being ill does not necessarily mean that you have a good sexual health or you're sexually healthy. It looks at how someone is positively, respectfully in their sexual relationships, but also it looks into physically how, if you look at the earlier slide here, if you're talking about the physical well-being of an individual, it is looking at, do you express and enjoy your sexuality? That is what sexual health is looking at. It is looking at, when it says not merely the absence of diseases, it is looking at, are you free from the risk of getting a sexually transmitted infection? Are you able to make a decision on when you want a pregnancy? Are you free from coercion, people forcing you, or violently or discriminatorily denying you your sexuality? That is what sexual health in broad terms looks at. So sexual health emphasizes the importance of sexual rights, including the access to information, education, and health care, among other emphases that sexual health wants to look at. Whether you do not have the risk of being violated because of your sexual orientation or because of your sexual health or your thoughts about sexual health. That is how far sexuality covers. It is similar to the definition of health according to the World Health Organization, that also looks at an individual's physical, emotional, mental well-being, and not merely the absence of disease. So that far, do we have any questions before I can proceed to the next slide? Thank you. Thank you, Thomas, for that remark. It is not actually only in South Sudan. We have seen in majority of our developing countries, women especially do not actually enjoy their sexual health. The reasons are very many. Perhaps many studies have shown that it is because of our social constructs. Some of our norms in our society do not virtually allow women to make decisions. So there are quite a lot of issues or a lot of reasons as to why women do not enjoy sexual health. And maybe it would be a good go ahead for you to identify why some of those issues arise in your community. It would be a good suggestion that you take a little study onto what happens in your community and the reasons as to why. So going into your questions, let us start with the one for James. The first, he asked the difference between sexual health and sexual orientation. When you look at my slide here that looks at sexual health, it is, let me just look at this other earlier definition here. Just a minute. This earlier definition, it looks at sexual health as one's ability. Ability means that someone is acting. So if someone is able to express, you as Thomas, if you're able to express and enjoy your sexuality, in that regard, sexuality, we are talking about your sexual interest, we're talking about your behavior. So if you're able to express that without without any, if you're able to express it without just here, let me, if you're able to express that sexuality, those sexual thoughts you have freely, from risk of getting an sexually transmitted infection or unwanted pregnancy for ladies, or coercion, violence, and discrimination, then you are enjoying sexual health. And if you're talking about orientation, your sexual orientation is virtually your preference for sharing your sexual expression. How do I express myself sexually? For me, do I prefer an opposite sex, or I prefer a sex of my own? If you prefer an opposite sex, it is heterosexual. If you prefer your own sex, it is homosexual. If you prefer both, it is bisexual. However, we are constrained. Why we are constrained is because we do not just decide that I want to be a heterosexual. This act is built from your childhood. That is why in this slide, I am saying that most people get a sense of their sexual orientation in childhood. That is why I earlier said that individuals who have grown, like us, Africans, who have grown in societies that say a human being cannot be a homosexual, or as a woman, you cannot admire a fellow woman, it is probable that we shall grow up knowing that we are heterosexual. We can only express our sexual feelings to a person of the opposite sex. That is one, to answer sexual health and sexual orientation. Two, between sexual health, how sexual health relates with nutrition. Just from this slide, when you look at sexual orientation in childhood or early teenage years, now the growth of a child is predominant on your nutrition. And because growth, therefore, determines your sexual your sexual behaviors. How? Your feeding pattern, one, but also how you feed as a balanced diet will determine how your body growth occurs. What happens is that your feeding levels determine how your testosterone levels are growing, but also how your estrogen levels are growing. And therefore, how you feed will then reassociate you into your particular sexual orientation. So for boys, their feeding pattern, that is why you would realize that the girls are feeding regularly. Or when you're born, if you're to do just an observatory study with girls in your society, you realize that at younger ages, girls are eating frequently compared to boys. Boys would go out to the wilderness to play, and their parents would not disturb them, because the more they are exercising there, the more their testosterone levels are building, because we know that studies reveal that physical exercise builds an individual's testosterone levels. So how someone feeds at a younger age will determine how they sexually orient, but also it will determine how they would behave. That is why in some societies, young boys who feed who feed on more feminine food. In that description, I'm talking about ice cream. I hope I am not going to attack anyone here who is doing a lot of ice cream, but we've seen in communities where boys who are younger, if in their younger ages, they are fed on junk food, on ice cream, more of feminine identified food, then there are chances that in their early ages of childhood, they will express their sexual selves in a feminine way. How will they express themselves to a, so when majority of the ladies complain that this man is acting as more of a woman, there are possibilities that during his feeding or his entire childhood nutrition, there are chances that the estrogen took over because of his feeding pattern. So those are some of the relations we have between sexual health and nutrition. It does not only work in childhood times, even adults. How you feed continuously keeps determining how many or your levels of the female or the feminine hormones and the male hormones. So the more regular you feed as a masculine person, the more masculine features you build. The more behavior you have as a feminine, the more feminine features you develop as a man. That is where nutrition plays a key part. Then there was a question from, I think, Clara on homosexuality, that I should elaborate more on homosexuality. But I think in my explanation for sexual orientation, I have explained it in there that in your sexual orientation, because of the way people socialize here in this slide, in their early childhood days, then they are able to develop feelings or romantic feelings towards people. So the difference or the issue with homosexuality here is that an individual of the same sex feels attracted to an individual of the same sex also. And this is telling us that these are issues that are more societal, but also more when we're growing in our early ages. That far, I hope I have answered all the questions. Unless there is any other, we can proceed to the next slide. I see we still have some couple of minutes to continue. That far, are we okay? Can I proceed?
Yes, you can.
Okay. Thank you. So we are looking at the importance of sexual health in public health. We're looking at the importance of sexual health in public health rather. And just in my previous discussion, I have virtually tampered or I've tackled a little bit on the part of nutrition. And all these are public health issues. Sexual health is a fundamental aspect of overall health and well-being for individuals and communities. Promoting sexual health contributes to achieving public health goals, such as reducing health inequalities and improving population health outcomes. As public health officers or as individuals that are advocating for better public health or a healthy population, sexual health virtually an individual being able to express their sexuality free of STIs is going to help a long way in reducing health inequalities, because as public health, we have goals in reducing maternal mortality. We have goals in improving nutrition. We want to reduce the number of nutrition among under fives. As public health, we are interested in reducing HIV/AIDS contraction. We have a number of issues to improve our population, and because we are tackling sexual health, it is going to go a long way in tackling some of those issues. In other words, it is more of a preventive measure for us that if our society achieves sexual health, their ability to express sexual the ability to express their sexuality free of the risk of STIs, then we are virtually going to reduce HIV. We are virtually going to reduce maternal mortality, child mortality, infant mortality. So it helps us reduce a lot of public health issues. But also addressing sexual health can positively impact various areas, and these include reproductive health. We know safe motherhood. Uh, we also know that a lot of mothers, as a result of poor sexual health, face a lot of challenges with their reproductive health. Because they do not have the rights to freely express themselves, their uptake of contraception is limited. And this is what affects reproductive health. Their desire to plan their pregnancy is limited. But also, sexually transmitted infection prevention becomes an issue if sexual health is not tackled. However, if this is tackled, then it gives us an upper hand in improving the quality of life. Just an intersection, like I had earlier discussed about nutrition. What is the relationship between between sexual health and public health? And these are more also of the importance. But whereas they act as a relationship, they also give us an insight of as to why sexual health is very important in public health. Sexual health intersects with public health through shared goals of promoting well-being, preventing diseases, and improving health outcomes. As we discussed what sexual health is, you realize that the definition looks at how an individual can express their sexuality free of STIs, which in this slide is also here looking at preventing diseases. So, whereas public health is looking at preventing diseases, the intersection is that sexual health is also looking at preventing these diseases. Public health approaches provide frameworks and strategies to address sexual health challenges at the population level. So, the frameworks we have, public health frameworks, are indirectly or they directly influence addressing sexual health issues. Public health frameworks on reproductive health. For example, we have got a framework on access to family planning. We have a lot of public health frameworks that are looking at individual rights, privacy. We're looking at confidentiality. We're looking at an individual's right to make an informed point of decision, or to make a decision from an informed point of view. Now, all these frameworks are actually strategies that address sexual health challenges. And this makes it a relationship between sexual health and public health. Furthermore, sexual health interventions and programs are integrated into public health initiatives. Just for the same way I have explained that ensuring access to comprehensive sexual education, preventive services, healthcare resources. All those are interventions that are similar to public health initiatives. The next, are we okay to go there so that I can introduce optimal sexual health? Optimal sexual health?
Yes, please.
Possibly, so that I do not make this more of a monologue. Anyone who understands the word optimum, or the word optimal comes from the English word optimum, and anyone who understands the word optimum, kindly give us a definition of, or your thoughts on what do you think is optimum. Anyone who understands that word called optimum? Optimum? Anyone who has an idea?
Yes. I think this is when you achieve something on the level of your feeling like if you feel like you have really maximum, you feel like you really achieve it. So that is
Yes.
just I can understand by this word. Yeah.
Yes, that is actually a very easy definition to understand what optimum is. It virtually means that you maximize your efforts with the resources that are available. If you had 1,000, if 1,000 can buy for you 1,000 pens, your optimum would be that you utilize this money according to the resource that you utilize. You buy these pens according to the resource we have. So in other terms, the optimal sexual health is actually looking at someone maximally attaining their ability that they are from our earlier definition, leave alone this one that encompasses the physical, the physical, emotional, but from this this earlier definition, oh sorry, I just moved it, but from here, optimum would mean that someone is duly or fully or maximally able to express and enjoy their sexuality. So if an individual is able to maximally prevent themselves from transmission of infections, how? By using barrier methods, using methods that control STI prevention. If someone is able to use a family planning method, or if someone is able to stop pregnancy, or someone is not coerced, is not violated, if someone has got all these rights maximally to be able to express their sexuality, then we can count that someone has an optimum sexual health. And this term is more broad in societal cases. It may less apply to an individual, but it can apply more on a societal base, that this society enjoys optimal sexual health. Why we would say that a society enjoys optimum sexual health is because in the society the risk of another person violating someone's right, for example rape, for example defilement, for example coercing someone in terms of I am the boss and therefore you are an intern or someone who is below the boss, and you will have to pay either sexually to gain a promotion or to gain a benefit. A society that is free from such would state that has achieved an optimal sexual health. However, we know in our societies that this is not the case. In very many societies in Africa, we still face a lot of challenges. We still have a lot of rape cases in our police stations, in our society, and unfortunately, in most of our cultures, uh, it is permitted. It is permitted that a man can virtually go and grab another woman, or vice versa. In other states, that a woman can actually just go and grab another man and express sexual uh, gestures towards them. In some societies, we have seen, especially in the developed country, even sexual gestures. People are being prosecuted for sexual gestures. We've seen in the US, we've seen in the UK that touching a lady you do not know in one of the private parts is an offense that is uh, is punishable in the courts of law in the US. However, our societies are struggling to adjust. In most of our communities, we still have people who when a young lady is passing by, they whistle towards that person, or even vice versa. When a young boy is passing, the ladies whistle and and all those are emotional issues that our society needs to realize affect someone's desire to achieve sexual health, or our society's desire to achieve optimal sexual health. So it goes beyond the absence of disease or dysfunction, and encompasses positive sexual experiences. Encompassing means it contains positive sexual experiences, relationships, and overall well-being. That is, I think we have oversung what sexual health is in that regard. The next is the components of optimal sexual health. The components include positive sexual relationships, like what I have said, that you're talking about a healthy, respectful, consensual. A keyword here, consensual, meaning that both persons consent to the relationship. So for a society or for an individual to achieve optimal sexual health, you must consent. Both of you must be respectful of your relationship. You must have a positive relationship, and to have positive relationship, we are talking about open communication. We are talking about trust. We are talking about mutual respect and shared values. Majority of you who might be in relationships, we're not directly attacking you, but we are virtually saying that these are the issues. If you to achieve
Sorry, Mr. Losias, if you can mute, if you can unmute. I did it mistakenly. I was hoping to mute. What? If you can hear me?
yes, there.
Okay. Sorry.
Yeah. That is all?
Yeah, you can go ahead. You
can okay. Proceed. You can proceed. Okay, fine. So another component, apart from a positive sexual relationship, is that you must have a pleasurable and safe sexual experience in achieving optimal sexual health, and this includes experiencing pleasure, but also includes intimacy and certification in sexual activities. Safety is essential, which involves practicing safer sex, using contraception, and protecting against sexually transmitted infections. Now, as public health individuals or people who are into public health, whether you're a nutritionist, whether you're a reproductive health expert, or you're a public health officer, this is where our public health issues originate from. And it is very important that you understand how population sexual health is, because majority of the issues, if it is maternal mortality, if it is not attending antenatal care, if it is the increase in sexually transmitted infections, all these issues are arising because people do not have a very positive sexual health. People are not enjoying their sexual health, and it is another key reason as to why these issues are coming up, even including gender-based violence. We have seen women going to other men looking for satisfaction, and at the end it comes out as a gender-based violence. We have seen the rate of STIs increasing. It is because you do not have a positive sexual relationship. So as a take home, I would want you to pay attention when we're discussing these components, because they are the key reasons as to why we're having a lot of public health issues out there. And another component is comprehensive sexual education. Now, this has been a debate, and in your free time, you could actually debate in your cliques or your groups out there about this issue called sexual education. Now, sexual education plays a vital role in promoting optimal sexual health. It provides accurate, age-appropriate, and inclusive information about sexual health, consent, healthy relationships, conception, and STI prevention. Now, our dilemma has been that majority of our society believes that if we give sexual education, regardless whether it is age appropriate, it will, for example, in your primary school, they will not allow you to have a sexual education because they are worried that you will inform children or younger people about their sexual health. Now, this is a very intense discussion in many societies. However, we have realized that even without sexual education being legalized in institutions, in lower level institutions like primary schools, we have seen that there are teenage pregnancies that are occurring in these schools. We have seen that there are actually inappropriate sexual informations boys are uttering to their fellow to their fellow classmates in schools. We have actually seen that there are young girls who are leaving school because they have started having their menstrual periods. However, the policies and the leaders are still saying that, especially the church leaders, the religious leaders, the Muslim leaders, are actually saying if we provided the young people with age-appropriate information, then they will become aware. But we already know, because the society has revolved, young people are accessing internet, young people are accessing smartphones, and therefore they are having information on sexuality, which makes them curious. However, to have an optimal sexual health, we will need comprehensive sexual education in our society, which is age appropriate. Of course, we cannot go to lower or young aged children and speak to them sensitive issues. but it is key. Sexual education is key in attaining an optimal sexual health in the society, because we shall have inclusive information, we shall discuss consent and STI prevention. Another component to achieve optimal sexuality, or another component of having optimal sexual health, is that the empowerment and decision making. Now, colleagues, this is I would want you to have a context. Just have a context back home or in your societies about empowerment and decision making. In this regard, you can look at decision making in sex specific between female and male, but we can also look at age specific decision making. Young people, elderly people, young women, young boys. What is your stature of decision making in the society? And decision making also comes into nutrition. The gentleman who was talking about nutrition. Now, who makes the decision on what you feed on? These are all issues that that you should contextualize in this component. So it's saying that optimal sexual health involves individuals feeling empowered to make informed decisions about their bodies, relationships, and sexual activities. And this goes a long way in determining how someone expresses their sexuality. If you cannot make decisions on family planning uptake, then there is no way you're in control on how you will give birth as a child or as a woman. If you do not have the power to make the decisions on which particular feeding pattern you want, then your chances of having a diet that can benefit your sexual health are limited. These are issues. However, vis-a-vis the challenges we are facing in achieving empowerment and decision making, there are some societies that have continuously improved their decision making. We have seen that today, some women have rights on when to have a child and when not to have a child, on when to prevent pregnancy and when not to prevent. There are also women who can make decisions, but furthermore, there are societies where they have their joint decision making, where partners jointly agree on how to live their sexual life. And this is where we want our societies to be, so that we eliminate issues of antenatal attendance, gender-based violence, STIs, where a partner does not inform the other about their their HIV status. All these. Another component, it emphasizes the importance of bodily autonomy and self-determination. In bodily autonomy, we are looking at an individual's ability to make decisions about their body. An individual's freedom to desire how to live their sexual life and how to self-determine their sexuality. Of course, do not take bodily autonomy or self-determination away from your socialization. You cannot just wake up one day and decide to have your own bodily autonomy that deviates from your cultural or from some of your positive societal norms. Your bodily autonomy and self-determination is always determined by your social construct, your spiritual construct. The churches you attend will influence. Your cultural background will influence the education you have. Majority of the demographic factors will influence this last bit of your bodily autonomy and self-determination. Let us go to components of optimal sexual health further and look at access to sexual and reproductive health services as one of the optimal sexual health components. Access to comprehensive sexual and reproductive health services is essential for optimal sexual health. This includes access to contraception, STI testing, treatment, sexual health counseling, and reproductive health care. Non-discriminatory and inclusive service is another component. Services should be provided in a non-discriminatory and inclusive manner, respecting individuals' diverse needs and identities. For those who are health workers, we have a role to play in offering non-discriminatory. You do not discriminate in a way that when someone comes in for a service, you say this one is Muslim, this one is Christian, this one is Pentecostal, or this one is of this tribe, this one is Ugandan, this one is South Sudanese, this one is Kenyan. No, you do not offer services according to race or according to someone's skin color. This is although in our African setting, this might be rare, but we have seen that this is a key component that the developed world is struggling with the issues of racism, with issues of ethnicity. They look at you as a black and you do not get a specific service. So to achieve optimal health, we shall have to offer services irrespective of someone's background, whether someone is disabled or whether someone is HIV positive, in order to remove the issues of stigma. Up to that far on components of optimal sexual health, are we good to go? Do we have any issues regarding components of optimal sexual health? So our next slide takes us into a holistic approach. Holistic approach, this virtually looks at how we could attain an optimum sexual health. Optimal sexual health takes a holistic approach, recognizing the intersection between physical, emotional, and mental well-being. It emphasizes the importance of self-care, self-esteem, body positivity, and overall mental health. I have virtually aired out, or I have interconnected an approach into achieving optimal sexual health. So right in the holistic approach, I'll just be perusing through faster so that we can tackle this and move ahead. So our last point on components of optimum sexual health was talking about inclusiveness and non-discriminatory. That brings us into the issue of addressing stigma and shame. Now, reducing stigma and shame surrounding sexuality is essential for promoting optimal sexual health. We are very much aware that in our societies, we do not freely discuss issues of sexuality. One, because of probably our religious backgrounds, but also because of our social backgrounds that look at discussing sexual issues as sensitive issues. And therefore, when an individual discusses these issues, they are looked at as people who are stubborn or people who do not, who are not brought upright. However, for us to achieve optimal sexual health, the first essential thing we must do is to talk frequently and openly about our sexual health. to reduce stigma, we need to we need to openly discuss issues of sexual health. You very much realize for those who do practice in health facilities, you very much, or even those in the society, for those who are implementing in the community, you realize that when someone has an infection, a sexually transmitted infection, or these ones, gonorrhea, syphilis, they struggle because of the shame and stigma associated to these diseases. They struggle to seek health care, early health care. They struggle to declare the challenges or the illnesses they have or the symptoms they have. So we need to address issues of stigma or issues of shame in discussing stigma. I mean, in discussing sexuality. Creating supportive and non-judgmental environments allows individuals to seek help. If you're a health worker or you're a social scientist or you're a nutritionist and you realize that an individual is ill, possibly the first thing after taking the individual's mark or after taking their weight and realizing that possibly they are in red, when you realize possibly this person's nutrition levels are very bad because maybe he could be having a HIV infection or an STI, and you judgmentally, you just say, when you're referring the individual for testing, and this guy is positive without even taking him for a test. Now you're creating a judgmental environment. So most times our health workers or our social workers create very judgmental environments, and people cannot access service or people cannot seek help. That's why we have a very poor health seeking behavior. But also our societies are very judgmental. That is why we struggle to achieve creating supportive and non-judgmental environments. However, we shall need to create this if we are to achieve addressing the issues of stigma and shame, and at large addressing the issues of sexual health. Just to go to the next slide, you're looking at the component of consent and healthy relationships. Because sexual health is a very sensitive matter in regard to being a self-related issue, most times it is not discussed openly. But also, most times you do not discuss an individual's sexual health without their permission. That is why we have an issue of consent. And in providing healthcare or in research, consent is one of the key issues. Even today, many countries have brought in consent in issues of taking photography, in taking photos of individuals. Many societies no longer, you cannot take someone's photo without actually seeking them for permission. And that is the same aspect of consent that applies in a discussion of sexual health. Consent is a voluntary, enthusiastic, and mutual agreement between all individuals involved in a sexual activity. So before you